Hi, my name is Mandy Stoll. This is my physical assessment head to toe video. So today I'll be performing a head to toe assessment on you. Basically start with your head and work all the way down to your toes, okay? I'm going to inspect and palpate your head, looking for any lumps, bumps, lesions. Feel my way down, palpating your temporal pulses. Can you open and close your mouth for me? Check your TMJ. Note any popping. Palpating down. Feeling for any enlarged lymph nodes. In front of and behind your ear. Underneath your chin. In the anterior and posterior triangle. Palpate your carotid pulse one at a time. Palpate your trachea. Palpate your thyroid gland. Any pain, noting size, mobility. Okay. Take a look at your eyes here. Check for pupils equal reactant to light and accommodation. Noting any drainage from your eyes, if your sclera red, conjunctiva, can palpate your orbital ridge, your eyes, your lacrimal glands, and I'll have you track my pen light here. Checking your eye movement. Okay. Take a look at your nose, checking for symmetry, noting any drainage, looking at your face for facial symmetry. Take a look at your ears, look for skin integrity, any drainage. And are you able to hear me okay? I'll note if you can hear me during my assessment as well. Take a look in your mouth. Have you say ah, stick out your tongue. Look at your uvula and your tonsils there. You take a look in your mouth, looking at your teeth, your soft palate, hard palate, looking for any lesions, any skin abnormalities in there, looking at your tongue. Okay, I'll have you turn your back this way. I'm going to inspect your posterior thorax, looking for skin integrity, checking for symmetrical movement when you take a deep breath. Go ahead. And I will auscultate your lung sounds on your posterior here. You take a deep breath. You can percuss the borders of your lungs here, listening for any abnormal sounds. You can check your kidneys, any pain. Okay, I'll have you turn around so I can see your front. Auscultate your temporal pulses. Carotid pulses. Move down to your anterior chest to listen to heart tones and breath sounds. First, listening to heart tones, we'll listen to the aortic valve, which is the second intercostal space, to the right of the sternal border. Listening to pulmonic, which is the second intercostal space to the left of the sternal border. Herb's point, third intercostal space to the left of the sternal border. Tricuspid, fifth intercostal space to the left of the sternal border. Mitral valve, fifth intercostal space, mid-clavicular line. I'll also listen to breath sounds. You take a deep breath for me. And listen to the right middle lobe. Okay. Check your skin turgor, capillary refill, looking for any edema. Perform Allen's test bilaterally. Should see your hand turn red when I release. I'll check your other one. Skin integrity of your upper extremities looks good. I'll have you lay down. Looking at your abdomen, I'm looking for symmetry. See if your abdomen is concave, convex, if there's any abdominal distension. I can observe for peristalsis, apical impulse. And after my inspection, I will go ahead and auscultate all 4 quadrants. Right lower quadrant. Listening for vowel sounds. Right upper quadrant. Left upper quadrant. And left lower quadrant. I can percuss across the border of your liver. Listening for dull or hollow sounds. I can palpate your apical pulse. Light and deep palpation in each quadrant. Note if patient's experiencing any pain. Any tenderness. Check your femoral pulse and your inguinal lymph nodes to see if anything is enlarged. I will check your radial pulse, ulnar, brachial, popliteal, posterior tibial, and dorsal pedius. Looking for any edema along the bony prominences. I can also check your capillary refill of your toenails. Can you grip my fingers, check your grip strength, see if they're equal. And I'll check your home sign. Tell me if you feel any pain. Any pain? And I'll have you get up and I'll do your Romberg's test. So go ahead and just stand with your arms at your side and close your eyes. I'm looking for any swaying. Very good. Thank you.